This is a really exciting time in cancer treatment developments. The whole idea of harnessing the immune system to fight cancer is a revolutionary idea that has finally come to fruition. And we now have 2 new approved immune therapies for cancer. These new therapies, called Yescarta and Kymriah, are effective for patients with blood cancers, leukemias and lymphomas, who have failed all other forms of standard therapy. Just a little bit of background of how these wonderful new treatments actually find and destroy cancer cells. The T cells are a normal immune cell in the body, and they recognize virus-infected cells and cancer cells. But to make them even more effective at recognizing cancer cells, what we and other scientists have done is to, by genetic engineering, introduce a new receptor into the T cell that is specific for a target on the tumor cell. Our new invention is a CAR T cell against a different target, which we call BAFF receptor. In other words, we make it easier for the T cell to find the tumor cell and destroy it. How a T cell actually kills a cancer cell is shown in this video on the left-hand side of this slide, in which the large cancer cells in green are going to be recognized and killed by the smaller white T cells that have been put in the patient. And because these T cells are from the patient's own immune system, we call this really a living drug. These are live cells that are put back into the patient. Unfortunately, in a large proportion of patients, the tumor eventually comes back and the therapy is no longer effective. This is because when the tumor comes back in these unfortunate patients, the leukemia cell has hidden itself from this therapy. And so there's a great need for a new treatment that can be offered to these patients that offers them hope. We can now offer them CAR T cells which are directed against a different target which still is expressed by the leukemia cell, called BAFF receptor. And these CAR T cells have been engineered to recognize the BAFF receptor and find and destroy the leukemia cells.
We did a head-to-head comparison of the 2 new therapies. And our data showed that our BAFF-R CAR T therapy actually did a better job than the FDA-approved CD19 CAR. And we think that in the future, we can actually apply to move this new therapy to as a kind of first-line treatment for lymphoma and leukemia patients.
Because of all the excitement with these results, we are moving very rapidly towards launching a first-in-human clinical trial within the next 6 months that will be offering this new therapy to patients whose tumors have come back after initial Yescarta or Kymriah therapy. This new treatment could also change the face of leukemia and lymphoma treatment, both in the US and worldwide.